Hello everyone. Today, we're exploring Nayzilam, known generically as Midazolam nasal spray. As always, this discussion is for educational purposes only. If you have health-related questions or concerns, please consult a medical professional. Description: Nayzilam, with the generic name Midazolam, is a nasal spray that belongs to a class of medications known as benzodiazepines. It is specifically approved for the acute treatment of seizure clusters, also known as acute repetitive seizures, in patients 12 years of age and older. Nayzilam is the first nasal spray designed for this purpose, offering a non-intravenous route of administration that can be used in community settings. This medication works by depressing the central nervous system, thereby stopping seizures shortly after they begin. Warnings: Nayzilam carries certain warnings due to its potent effects. It should be used with caution in individuals with a history of respiratory issues, as it can cause respiratory depression. Additionally, it is not recommended for patients with narrow-angle glaucoma. Benzodiazepines, including Nayzilam, can lead to physical dependence and withdrawal symptoms if used for extended periods. It's also important to note that Nayzilam can cause serious allergic reactions in some individuals. Before taking this medicine, Before starting Nayzilam, inform your healthcare provider about any medical conditions you have, especially if you suffer from glaucoma, liver disease, respiratory problems, or if you have a history of substance abuse. It is crucial to tell your doctor if you are pregnant, planning a pregnancy, or breastfeeding, due to potential risks to the baby. Patients should also disclose all medications they are currently taking, as Nayzilam can interact with other drugs, leading to increased sedation or respiratory depression. Side effects: The use of Nayzilam can result in side effects, including drowsiness, headache, nasal discomfort, throat irritation, and nausea. Due to its sedative properties, patients should avoid activities requiring mental alertness, such as driving, until they know how Nayzilam affects them. Severe side effects include respiratory depression, severe allergic reactions, and withdrawal symptoms if the medication is stopped suddenly after long-term use. If you experience any severe or concerning symptoms, seek medical attention immediately. Interactions: Nayzilam may interact with other medications, particularly those that depress the central nervous system, such as opioids, other benzodiazepines, alcohol, and certain antidepressants. These interactions can increase the risk of serious side effects, including severe sedation and respiratory depression. Always inform your healthcare provider about all the medications you are taking to avoid harmful interactions. Dosage: The correct dosage of Nayzilam is crucial for its effectiveness. The recommended initial dose is 1 spray in 1 nostril. If the seizure activity does not stop, a second dose may be administered at least 10 minutes after the first dose, as directed by a healthcare provider. Do not exceed the recommended dosage, and use Nayzilam only as prescribed by your doctor. Avoid: While using Nayzilam, it's advisable to avoid alcohol and other central nervous system depressants, as they can enhance sedative effects and increase the risk of respiratory depression. Patients should also be cautious about engaging in activities that require alertness until they are familiar with Nayzilam's effects on their bodies. FAQ: A common question regarding Nayzilam is about its safety in children. Nayzilam is approved for use in patients 12 years of age and older. The safety and effectiveness in younger children have not been established. For specific concerns about using Nayzilam in different age groups, consult with a healthcare provider. Closing: That concludes our overview of Nayzilam. Remember, this information is intended to educate and should not substitute for professional medical advice. Always consult with a healthcare provider for any questions or concerns about this medication. Thank you for listening.